Welcome to the Pharmacists Are In, a podcast made for pharmacists by pharmacists. Pull up a seat and let's get started.
Welcome back for another episode of the Pharmacists Are In podcast. My name is Ajit Johal. I'm a Vancouver-based pharmacist, and we are streaming live from Pharmacists Toronto. I'm joined by my co-host, Dr. John Papastergiou. John.
You know what, Jit? I've been waiting for these two all day. Hitesh is like the pokeroo, flying around the conference. Him and Justin are the most popular two guys here, but we've been excited to talk to you guys about what's going on in Ontario. I mean, our purpose here today was to kind of expose our audience to what pharmacy use like, people that may not have come, right? And a big part of it is the networking, I think. And who better to network than these two gentlemen?
Absolutely.
So Hitesh, me and Hitesh have known each other, I think, the longest. We started at Shoppers Drug Mart about the same time.
Absolutely.
I started in 2002. He was there even before me. And we've done a lot of work over the years together. But Hitesh has gone into advocacy for the profession. He's become a big voice. So Hitesh, tell us a little bit about your experience and what that's been like.
Well, you know what? It's a timely conversation. We just had our Queen's Park Day in Ontario. And, for the first time ever, we actually had 4 ministers that we had one-on-one interviews with during Queen's Park. And obviously the Minister of Health who joined us at our reception, and really the message was very clear in terms of what pharmacists can do, and we can do more. I think that was a very clear message. But it was more from an advocacy perspective is the sustainability of pharmacy in the profession. We can do more, but we got to have, this has been a chronically unfunded system. Pharmacy in Ontario has been chronically unfunded, and really that was our message. We really need to start with funding pharmacy appropriately, with at least bringing our dispensing fees to par, and then we can do more and take on more services, and make pharmacy more viable and part of really the healthcare ecosystem in Ontario.
And, I didn't even introduce Hitesh's role. So you were past chairman of the Ontario Pharmacists Association, and now your role's changed a little bit?
I'm actually the current chair of the Ontario
okay.
Association, and we have an incoming chair.
Chair, yes.
And this is my third year on the Ontario Pharmacists Association. As you know, I'm also a pharmacist owner,
yes.
A Shoppers Drug Mart associate owner, 3 downtown locations, and life is fun.
Right in the heart of the craziness.
Right
and Justin, CEO of the organization, and you've been in that role now for how long?
It's hard to believe, but it'll be 7 years this September.
Shit.
So I started, I think, about 8 months before COVID. And the amount of change that I've seen in that time frame, in a positive way, in a lot of ways, looking at where we are today, even though we're still playing catch-up in Ontario, and I think everyone would acknowledge that there's a lot of catch-up to do when it comes to the funding model, in addition to the scope of practice. But I'm excited and I'm optimistic for the future of pharmacy, not just in Ontario, but across the country. When we look at the challenges that we have with primary care, the gaps in the system and the need to create capacity, we're ideally positioned now because the public perception of pharmacists and pharmacies across the country has never been higher than it is today from a favorability perspective. They see what you do beyond the traditional medication dispensing and into more of the holistic looking after a patient in their journey. And I think really we're right at the beginning of that holy grail of chronic disease management, But Hitesh, you really were spot on. Like, we can't do any of this unless we have the sustainability behind it. And that is recognizing that, like other health professions and other provinces, it needs to be reasonably funded. But we're hopefully in the next couple of months going to see the next tranche of scope that gets us into more point-of-care testing. That we hope will then lead into initiating therapies and chronic disease management, more vaccines and more minor ailments. And hopefully over the next several years, we'll continue to build on that momentum and success. But it's all about making sure that we're at that dinner table conversation in the households, talking about not just doctors and nurses and hospitals, but what their pharmacists can do for them and how we can continue to unlock that value.
So, Justin, it's we were talking about this earlier today. It's always easy to say, oh, things aren't moving fast enough or whatever. But when you look at CPHA has that little chart, right, with all the scope. And, I look back at when I graduated, and even in Ontario and where we are today, we've moved forward fast, right? So, we're behind some of the other provinces, but definitely the movement is there. But, I wanted to ask specifically about kind of this next set of scope. So maybe explain to the audience. So we heard that, legislative change was coming. We were going to have more point-of-care testing, and then you hear nothing. So what happens in that period of time, right?
There's so much, and it is a complicated ecosystem we operate in. You have the regulatory pieces from a government perspective, the public consultations, announcements, and all of that. And then you have the college. And the college, in some cases, has to go through their own public consultations. And in this particular case, I would say that we're hopeful for a July 1st implementation. But there still is that one piece around labs that we know that the regulations need to be amended, which is great for pharmacists, because that will open up what we believe will be a panacea of opportunity when it comes into other things like initiating new therapies and diagnosing and so forth. But at this stage, it's really with the college. The college is looking at safeguards, workplace issues, and that has held up some of the timing of implementation, because they have to go through policy changes that also need consultations, etc. So, and then there's just the government priorities around doing this all together. So they wanted to do this initially in an implementation with other healthcare providers. And that means you're tied into their scope of practice changes and their regulatory pieces. So it's not just pharmacy. I would love if they did it more, start with pharmacy and then worry about the others. And they wanted to do the entire package that included vaccines, point-of-care testing, and minor ailments expansion at one time, rather than, well, if it's going to take longer for point-of-care testing, let's wait on that or continue the process and implement vaccines right away. I think our biggest concern is being ready for fall, the respiratory season, certainly, and to have the time from a logistics and distribution, planning and ordering perspective, which really means now. Now needs to be the time to put all that in place. The government is still earmarking July 1st. But like I said, the lab hasn't yet had a public consultation on regulatory change to enable pharmacists to order and interpret. So we know that's at least a 30 to 45 day public consultation window. So we're kind of caught up in that cycle of all the different regulatory pieces. But I think we're finally coming to a conclusion, which is a very positive outcome for patients in Ontario and pharmacy professionals.
Hitesh mentioned reimbursement. Could pharmacists expect some reimbursement for this type of stuff, or do we not know? Or
well, we, in parallel to all of this, are discussing with the ministry folks what that reimbursement framework is going to look like. And, the adage is true that if it's not funded, it's probably not going to happen, right? And I think that's the expectation of any service. And we've seen services that are unfunded in Ontario, and that's problematic. And we know that other fees are subsidizing those underfunded or unfunded services in a pharmacy. Think of renewals and adaptations as one example. Even though you have the scope, it's very difficult if you don't have the funding mechanism behind it. Can't charge patients. We can't charge patient differences of costs, unlike other businesses. And there's a real cost to operationalizing services and delivering care in the pharmacy. And I think we've convinced the government. I don't think there's any opposing voices to reasonable reimbursement. But then how you define what is reasonable to us versus them is part of that negotiation. But in short, we are discussing a more complex reimbursement model for point of care testing. You have to think about what kind of test are they going to implement. Is it going to be a rapid antigen test, more molecular-based test? Does it need a lab result or not? So there's still some detail to work out. But we've come up with a funding model kind of akin to what it was for COVID testing, for PCR. So you have a collection and assessment fee, you have a transportation fee, you want to cover your costs over all the devices that are needed, and depending on the cost of the device, that has to be built into it. So we have done some early thinking around that. For the vaccinations, our expectation would be that it would follow the COVID fee, not our flu shot fee. And of course, the government would prefer to anchor to the $8.50 for flu rather than $13 for COVID. But we're trying to look at comparisons across the country. Ontario tends to lag in that area too and be the lowest, like our dispensing fee. But these are a lot of asks going into government when we think about dispensing fee increase. Just to keep pace with inflation over the last 12 years, it's a $700 million investment from government. And then we want to index the CPI. Then we have new scope we want to fund, which is a price tag to it. And we want to do clinics. We want to have a healthcare hub where we can actually do what's happening in other parts of the country, where we know it addresses the primary care gap. But that's another investment. And you saw in the most recent Ontario budget just how austere it was, and hospitals, and for good reason, did receive most of the increases in spending because they've been decaying in terms of funding, and there's huge gaps there. So I think our biggest opportunity here is going to be tapping into the envelope of money around primary care and primary care reform and getting out of the drug budget, because when we're pigeonholed to the drug budget, it makes it very difficult for us, even though we're in public health, different budgets, primary care with services and prescribing authority, and medication management. So it's both a blessing and a curse for us to be in the drug budget.
Do you feel like the government, because I've heard a lot about, okay, the government's distracted with what's going on in the U.S. and tariffs and this and that. Is there still the appetite, though, to invest in pharmacy like that?
Well, you raise a good point. There's no doubt that the oxygen is going to the economy, to jobs, stabilizing, building Ontario, building the country, and it needs to be. We need to look at various trade arrangements that are not necessarily north-south, and the destabilization of that relationship with our biggest trading partner understandably dominates the topic. And when you look at the job losses, in Ontario, heavily dependent on the automotive industry, manufacturing, that is even more exasperated. So I think where we have to make sure we position ourselves, depending on who you're talking to, of course, if you're talking to Treasury, Finance, and Premier's office, is about how does this help consumers? Doug Ford has got three main priorities: affordability, so pocketbook issues for Ontarians, protecting consumers and access to services. And I think we align very well. You look at our GDP output, we're over $7 billion in terms of creating GDP in the province, job growth, etc. Life sciences, huge investments here. So it's a play for the economy, play for jobs. It's a play to make sure that we're managing costs with respect to chronic diseases and that sort of thing, because it is costing the government more by having a primary care crisis, and we have a solution. So you have to tie it into those and make it a priority for them. But it is difficult because there's a lot of noise out there, and hospitals and other healthcare providers are all at the table as well, trying to get a small sliver out of that budget. So, but I think we've proven that we have the influence, we have the solutions, and that we will make progress on things like dispensing fee. It's just going to take time, which is frustrating, but that's where we're at.
What works from an advocacy perspective, John, I think, is this notion of our healthcare hubs, right? You come into my practice today, right in the middle of downtown Toronto. We are already a healthcare hub. Half of those services that we're providing are for free. Yeah. We have patients waiting for consultations. We are doing prescription renewals. We're doing adaptations for free. And that kind of language and that kind of perspective with government seems to strike a chord. But really, when we start talking about funding and advocacy, that practical example of having this concept of healthcare hubs, it's really important. And I think we did a really good job at Queen's Park to really emphasize that we have them. We currently practice in that environment. They're just not funded.
Well, that's what I was thinking. Your presence there is kind of a frontline pharmacist, business owners. You see it every day. So, I mean, how do they react to that when you go in and you tell these stories and, you're in a tough area, downtown Toronto, 24-hour store, The service that you're providing there is expensive, man. It's expensive to run a business down there. I mean, we see it shrinks out of control. It's tough to keep these retail outlets open. Do they get that, you find?
They get it. I think the way it works with government, and we're learning, and, we, after Queen's Park, the one thing we learned is if it's not this budget cycle, it's going to be the next budget cycle. And you got to be persistent, and you got to continue. You may miss a budget cycle, and it's very disappointing. It's really hard for us to go back to our membership to say we weren't in the budget this year. But it's really going back at every budget cycle, advocating, making some noise, as Justin was saying earlier, really getting that patient impact, and we have to keep at it. This is a game of persistence.
Because we're seeing in the U.S. retail pharmacy struggling. I mean, it's a mess down there. The U.K. they're the same thing. Is there that fear that if we don't support community pharmacies, like things could change? And we're providing a pretty valuable service.
Well, I think our scope of practice varies across different international jurisdictions, and the more we can move into a service model, because let's be honest, the transaction drug distribution model is continuing to erode based on the cost of goods and deflationary pressures. Obviously, when you have erosion of margin, you're looking at efficiencies to try to compensate for that volume, but you're going to reach a tipping point. And I've often said there's more disruptors coming. We haven't really seen disruption in the Canadian market. It's been slower here. We're a bit late on things like Amazon Pharmacy, Amazon Cares. Although it failed in the U.S., watch and think of the value prop that Amazon comes to the largest payer in North America and says, top 100 drugs we'll deliver within 24 hours and we'll save you $1 billion and we'll do a $5 dispensing fee. Right? That's a strong case that the government's going to be very hard pressed to say no to. 10 years ago, drug distribution costs were so high in Canada, and it was prohibitive. Mail order was challenging, the way our population is distributed across the country. There were a lack of regulatory enablers for cross-provincial trade. And then you look at the fact that consumers weren't ready for it, right? Pre-COVID, I still wanted to go into my pharmacy. Right now, our value isn't going to be the bricks and mortar for dispensing. That's going to be taken care of by, and it could be current players that embrace that technology and innovate and do that. Is going to be the services. That relationship with the patient is critical, and we have an advanced scope across country. If you look at Alberta, Nova Scotia, Ontario is catching up. That's going to be where the money will be, and that's where it's going to end up. But it will also lead the other parts of the business. So point of care testing, if we're not out in front of that, and patients for strep and other things, because if I'm doing it and the store across the road isn't, where do you think those scripts are going to go, right? And I think it's there. I mean, Jim Balsillie famously said about BlackBerry, no one will ever use a touchscreen, right? Yeah. Well, and I've heard this from pharmacists, they say, well, someone's always going to want to come into my pharmacy for dispensing. And that may be true for a portion of the population, but if our bricks and mortar is what we're relying on, this pharmacy model will go the way of the other countries. In the U.S., that's a PBM problem as well, right? You've got the American-style PBM is squeezing, because they're making more money, the PBMs, than all of the pharmacies combined. So the providers that are delivering care are making less than the middlemen who are doing administrative work. And that's because their rebate program is the flip of what we have in Canada, and there's a variety of reasons for it. And that's why OPA is very much on regulation of PBMs and the predatory business practices that they have put in place, and make sure we have patient choice, because also the pharma companies are looking to go direct to consumer.
Yes.
You got that whole threat coming down the pipe. So how do we embrace that as a pharmacy sector to make sure that we still own that or are stewards of that patient relationship? So no matter where they get their product, we're involved in it and be part of that model. Otherwise, we're going to be left behind.
So Ajit's from BC. I'm sure you're hearing some common themes of challenges you guys are having.
Definitely, yeah. So yeah, thank you for that overview, Justin. I think it's not unique to what every province is trying to do to support expansion of pharmacy, but also make it sustainable, right? You can't do more with less. So in BC, we did have ordering of lab tests within scope, but no reimbursement. So it's not being done. So you're absolutely right. What would happen if that's the case? The other thing is the immunization one is interesting because as you may be aware, the BC College back in 2009 made Schedule II inclusive of all vaccines, but really you want those to be pharmacists prescribe. You want the authority to prescribe those vaccines because that just eliminates all of the bureaucracy and it just makes it very clear. It's very astonishing to me to see, and I've said this at multiple national presentations, to say that, the reimbursement for a flu shot is less than a latte at Starbucks. It's ridiculous. And a flu shot in Ontario is no less valuable than a flu shot in Alberta or in BC. So there should be some harmonization of fee for administration that's north of $10 at the very least. So that's currently the standard of what, at BCPHA, we did do some calculations in terms of time and blah, blah, blah. And that's typically, what's in line with most jurisdictions. And a vaccine is a vaccine. So for COVID, actually, we did have that. It was originally, I think it was 18. Now that's moved down to flu. So I think you're right. Setting the benchmark for what COVID is the bare minimum. And then the other thing that I think could really benefit Ontario, not only the addition of prescribing authority for all vaccines, so just use the guidelines, use the discretion, because there's so many pharmacists in Ontario that are so knowledgeable that present with me on the whatever circuit, so they can easily independently do this. But it's also the access to publicly funded vaccines. And that to me is a huge issue that I would like to highlight, because in BC we have access to adult pneumococcal 20, we have access to HPV, and we're seeing higher uptake rates because we're not restricting that to a doctor's office. And I think that's a huge aspect where Ontario could benefit, being a larger population. There's I hear so many anecdotes from my Ontario colleagues saying, a patient actually paid for this. They could have gotten it publicly funded, but they're like, you know what? This isn't going to happen. So happy to support any narratives of what we're doing in BC to see how we're moving the needle with public programs and obviously sharing the advocacy. And I really like what you said about advocacy happens at the dinner table, because that's the patient's dinner table. And the impact you have with patients is what really is the micro advocacy that just is like the 1,000 cuts into government that helps move the needle. So thank you for sharing that.
That's the grassroots, right? And governments like to do things that make them popular and to get them reelected. So that's clearly one of the areas you need to drive in the priority areas of government. I will say this, that we make it very confusing for patients to navigate the system. Even in Ontario with this next adult vaccine bundle, doesn't include HPV. I think it's the only vaccine that actually prevents cancer, and yet we're not making it as accessible as it could be. That's a huge miss. And I think that the fact that we do a list-based approach, that you need a prescription for some, but we can't get it from pharmacy. I mean, all of that makes it very confusing for the average person, because they know that a pharmacist is where they go for certain vaccines. They assume that you can do it all. You have a captive audience and you have to turn them away. And we know that if you turn a patient away, the likelihood is very much greater that they won't get the vaccine.
Absolutely.
So it's about simplifying it for the patient, and it's about maximizing the resources and capacity we have in the community. But even minor ailments, I mean, what is a minor ailment? Like, a lot of people I talk to don't know the list of minor ailments, right? They know, well, I know this 19 minor ailments. They know that they can go to a trusted healthcare professional like a pharmacist, but all these guardrails, all they do is limit patients' access and create, and it would really make it worse, the primary care gap with all the unattached patients. And, government needs to get on board with this, or they're going to end up with more and more people in bed blocking and in areas where the system is burdens. And we are now in this country treating ERs like primary care doctors. People are presenting themselves for things that could have been done in the community.
Yep.
And yeah, the beds are always going to be full, but they need to be the right person at the right time. And the fact that we have 40 million people in this country, and based on postal code, things are covered or not covered, or enabled or not enabled, is really asinine if you want to be honest about it, right? We got to figure this thing out.
Definitely.
So, I mean, is this something that happens? I hear Ajit talking about BC. Do the associations of the different provinces connect and kind of try to get aligned? Is that?
Well, we do. I mean, there's certainly a lot of collaboration at a national and interprovincial basis, and obviously most of healthcare is provincially delivered. And there's a role for the federal government, of course, and the federal government is getting more involved with talking about the Candid Health Act and services, and so that's good, and I think that will help accelerate some of the implementation adoption across the country. But because of the provincial nature of it, it does present some challenges. But I think from an Ontario government perspective, they do care about how they compare and rank amongst the other provinces, and that is a driver for them to make changes. We have a very enabled Ontario Medical Association that unfortunately has not been an ally and does create challenges, although I think their influence has decreased on that front in terms of being able to stop scope. But they put the fear out there and, the misinformation, and I will use that maybe even disinformation to be fair, and in government, they're a big stakeholder. So we have the typical turf protection issues here, the sheer volume of the size of the province and the investments that are going to be required are big numbers. So, and because it's so siloed in government, very difficult to break that down. But that's why it takes time, and that's why the incremental approach, while frustrating, and people are like, well, why can't they just rip the Band-Aid off and do it? For government, it's managing risk and also the fiscal component to it. So I would say to anybody that is frustrated and to the point of apathy, we are making progress, and I'm confident that building in a dispensing fee over several fiscal years and indexing it to CPI is within reach. It probably won't be what everybody wants it to be in the total amount, but we're having the right conversations with the right people in government, and that will help us with the scope pieces. We have a PR campaign coming out in May talking about funding for unfunded services, scope, and also the overall sustainability. And I think that pressure point is going to be very beneficial for us to get it over the finish line.
And we have the patients behind us. So the success of the minor ailment program, and every minister that we met with spoke about the success of the minor ailment program. And so we have that momentum now. We have the public behind us. And the campaign that Justin's talking about in May will be very effective because it's going to bring more education to the patients. And patients like this program. And so I think patients are seeing more value in the services that we're providing, and they're seeing us as primary healthcare providers. So, and that's changing the conversation, and there's more to come. So this is a very exciting time.
That's why I like talking to you guys. You get some perspective on what's going on behind the scenes, and I think that's why you guys are so popular at the conference. I know, not to change direction here, but I know there's not as many opportunities for community pharmacists to kind of interact anymore. There used to be more. I know when we started, there was more conferences. This is kind of the big one now in Ontario. I mean, happens in Vancouver and in Montreal. You guys are also a vendor here in the vendor hall. Do you get a lot of traction from the pharmacists that are coming to visit you? Do they have questions? What's the vibe like in there?
Yeah, I would say that this is the largest of all of the conferences, and it's good to be able to interact, especially face-to-face, learn about what's working in other provinces, what isn't. We're talking about point-of-care testing, and talking with some of the vendors here about, look, this worked well in PEI, it didn't work well in New Brunswick and Nova Scotia, and here's what we can change. It's very valuable, and what we're hearing about is a real appetite for understanding some of the things that are happening that they don't necessarily see and hear about every day, in the intricacies of decision-making. Even with our college, I mean, in some ways, our college is a barrier to us being able to move forward, and you can see that in BC, where they are rethinking self-regulation, which I think is a valid topic. We need to think about, do we even have self-regulation today? All the costs and administration towards these colleges. Is there a better way to do it? But at the end of the day, these are the kinds of ideas that you can create in a venue like this, and I think people are really excited to hear about some of the things that we're doing on scope and fees. And let's not forget that at the end of the year, although it has to be implemented, we're ready to go with patient choice and trying to break down some of the barriers, because I'll tell you what, no matter where you are on that discussion around PPNs, open, closed, I think everyone can get behind the concept that patients should be able to choose their healthcare provider. And if we want to have a service-oriented model and be ready to go for all the disruption in 5-10 years, we better make sure that patients can choose where they go. And that's a huge seminal policy for Ontario. It'll be the only second province to do it. I mean, Quebec is always an asterisk because their legislation is different, but we'll be the first outside of Quebec. And Ontario is very, very rarely the first in anything. So we can take some, I think, at least appreciation for the efforts that went into that, and the what the implementation will look like still to be determined. But the fact that we got there, it's a big thing.
No, it's been a fun, excellent day. For pharmacy. We've had a booth here today, a very prominent booth. It's been really amazing hanging out at the booth, meeting people from different aspects of pharmacy, meeting pharmacists, meeting our vendors, our suppliers. So, we need to do more of this. And
I think so. I think part of the value, obviously the CEO programs are important, but it's this ability for the profession to kind of interact and share kind of what their experiences are. Pharmacy, you operate in a silo a lot, man. So unless you get out and meet other people, you really can feel like you're alone in it. But there's so many common issues, and even, talking across the provinces and everything else. I think we're in a unique situation this year. FIPs in Canada for the first time in a long time. I think it would be great for Canadian pharmacists to showcase what we're doing, because we forget sometimes how, globally, we're really front runners. I mean, we always talk about, moving forward amongst ourselves, but when you look at us compared to the rest of the world, they're really looking at us as leaders, right?
And I think we have to look beyond just government, right? Like, the innovation is something that pharmacy needs to embrace more of and not see it as a threat or a challenge. And at the end of the day, there's private models here that make a lot of sense when you look at diversifying revenue. What do patients want when you get into things like skincare? I mean, everyone wants to look younger. Everyone wants to look better. There's huge opportunities there for revenue that are more sustainable, frankly, than relying on government policy and funding. So that'll always be a part of the business. But I think the future of the pharmacy model is diversification. You see it with nurse practitioners, right? And nurse practitioner-led clinics. Mm-hmm. And I think you see it with the co-location of clinics within pharmacies as well. So, where this goes from where it is today is the exciting roadmap. And for us as an advocacy association, we're there to open those doors, make sure that it's funded, and businesses will compete. They'll end up going where they go, but we want to make sure the opportunity is there.
Yeah, I'd love to get you guys on more often, and I think it's so important, the work that you guys do behind the scenes. And I think pharmacists, for the most part, have no idea how complex this whole process is, and to really get some insight into what you guys have taken on for the profession and continue to kind of fight to push it forward. It's always interesting to chat with you guys and get your perspective. I think pharmacy, you did a great job this year again. It's going to continue to grow, and hopefully we showcase Canadian talent at FIB, and we get to talk to you guys again, maybe in Vancouver. I don't know.
This is clearly the highlight of Pharmacy U for us, is this podcast.
I think you guys get to have a very strong presence at FIP. I think the Canadian Pharmacists Association will be out there, very loud at FIP. So, make sure you guys are out there.
Yeah, get the word in for them. We were talking to them before. They said they'll connect us.
Yeah.
It's anywhere.
Well, we have a contact.
Yeah,
He's a very
Mr.
prominent
Gurji.
member
Yes.
of ours. So
we can work on him.
We can work on that.
Is he here today? By the way, he didn't stop by the booth. Oh, he's not here, right?
I haven't seen him. But
I haven't seen him either. Yeah.
We'll get on together before FIP. How's that?
Yeah, that's awesome.
Looking forward to it.
Yeah, we'll do another segment, and our audience is growing, guys. So we might be a great platform for. These guys were on my case. We were at a Blue Jay game. I didn't renew my membership, So I got to the bottom of it.
I heard.
It was my credit card. I changed my credit card.
Well,
I'm on auto renew. I thought I was renewed, right?
Yeah, your old credit cards.
Yeah, so I'm. But they followed up with me, the team. So yeah, I'm back now. Make sure I'm. And I think that's another important message.
It is.
We gotta support these guys as pharmacists. And I'm late, but not that late. But we gotta. If you're listening and you're not a member, it's amazing to me that people aren't members. I think this is your profession. We want to continue to push it forward. You got to support them. They need money to do that. It's not free, and a lot of work goes on behind the scenes. I see how hard Hitesh works. He's there all the time, and time away from his family and friends. It's not an easy job, but someone needs to do it. So thank you guys for your contribution.
Thank you. Thank you for having us.
Oh, thanks for coming on.
All right. Take care.
Take care.
Yeah, guys.